sometimes we call it this patient has been too long at the mechanical ventilation, so it's not going to do well. So is there a maximum safe period of mechanical ventilation before like ECMO loses benefit? As you spoke about certain patients just lingering around PF of somewhere around 100, 120, we don't know what to do.
I think this is something we learned on the way. So if you look at some of the older papers, when I say older papers, papers published about say 7 or 8 years back, one of the contraindications to ECMO used to be the group of patients who used to be mechanically ventilated for more than 7 days. This was derived from an ELSO registry study, which showed that if you ventilate your patient for more than 7 days, outcomes are poor. It's not appalling, it's still poor compared to those who are ventilated for less than 7 days. Now, we extrapolated this every time. We used this as a criteria for inclusion till COVID landed. And when COVID landed, it taught us a lot of new things. One of the things we figured out during the management of COVID was most of the time COVID involves multiple organs. But over a period of time, when other organ failures settle down, it's the lung failure that lingers longer in COVID. Clearly, these patients required prolonged respiratory support, and some of them needed renal support, while other organs usually fell into place. And that's when we started re-looking at the duration of mechanical ventilation as a criteria. So we did, as part of this management, a Delphi consensus was obtained with the experts, and they all opined that duration of mechanical ventilation should not be a defining criteria or an inclusion criteria. And clearly, if a patient has only single organ failure, say respiratory failure, even if he is into the second week of respiratory failure, he should be considered for VV ECMO at that stage. So, and last week, your timing of the question is so perfect. Critical care medicine has published a very nice paper looking at the duration of mechanical ventilation prior to ECMO. And our Chinese colleagues have essentially shown that it doesn't matter. No longer matters. So, but having said that, I'd be a bit skeptical to offer ECMO to someone who's been ventilated for 3 to 4 weeks. I think it's a bit too late. But at least we are now stretching from 1 week to 2 weeks, especially at 14 days. If it is a single organ failure, I'd still offer ECMO in that context.
So it's not about the mechanical ventilation, it's about the overall process of the disease, as we spoke about. The fibrosis is certain and lungs are not going to recover.
True. Logically, if you look at it, you would expect more villi in these patients, ventilator-induced lung injury, especially the way we ventilate them with TARDSNet ventilation. You would expect that to happen. But clearly, it has not been shown that that is the only one that eventually is responsible for the patient's mortality.